Hi, I'm David Gantt, your Buncombe County Commission Chair. I'd like to talk to you about our April 17, 2012 Buncombe County Commission meeting. We basically got reports last night, and some of the statistics and some of the reports I want to share with you that I think are significant. First of all, we heard from our sheriff about public safety, and a really surprising number to me is the volume of calls we get on 911. In Buncombe County, we get 220,000 calls a year. That's 600 a day. And all of these calls have to be routed to the proper facility. Thankfully, Buncombe County has been very progressive in getting a lot of the law enforcement people and emergency service people all in one room, so they literally can talk to each other and see each other and coordinate so that we get things done faster and we do it the most efficient way. It's good stewardship of the taxpayer money, but there's a big facility next to Irwin High School where we have everybody in this big hall, and they all have their computers. Some of them have 5, 6 screens. They're doing amazing multitasking, but we're real proud of that. We also heard a little bit about adult homes. And adult care homes are a real problem for us here. It's a good thing in that Buncombe County has more homes than any other county in the state, including the metro counties of Mecklenburg and Wake County. The bad news is that over half of the people that live in these adult care homes aren't originally from Buncombe County. So what we have found is the homes, because of the number of beds we have here, have gone to South Carolina and surrounding states and recruited people to live in Buncombe County. Well, that's probably okay in one sense, because that means the Medicare is paid, and that's a federal program. Here's the rub. The people that live in these homes, they aren't regulated very tightly by the state or anybody else. Local government has no authority to shut them down or penalize them when they do things that are bad for their residents. A more troubling problem for us is the cost to the local government. Because they're not regulated, they don't really have the management that they should for some of them, because it's the whole range. And these are folks that otherwise might be homeless. These are folks that otherwise don't have a place, but they're not from here. The deal is that the 911 calls, the ambulance service, the police calls, the number of local services that have to be involved are close to $1 million out of the taxpayer Buncombe County's budget. We have asked the state for, we want everybody to live here. We want to have an open community, but we want to be paid and treat people fairly. We first of all feel that the local government should have some more say, and the state should take a bigger role in regulating these facilities. Obviously we need them. Obviously Buncombe County has become a mecca for adult homes. But when we have them, the average number of prescriptions these folks take are 15 medications a day. So if they leave the home or get out and they don't take their medications, bad things happen. It's happening in neighborhoods around these homes, and we don't want that to be a danger to our communities, and more importantly, we don't want it to be a danger of the residents wherever they're from. And so we're asking the state to be a bigger player here. We're also asking for the state to give us more regulations so we can protect these people. And most of the homes are great, but the ones that aren't great, that get the vast majority of our calls and our taxpayer money to take care of them, let's regulate those, and let's shut those down if they're not doing what they said they're going to do, if they're not properly taking care of the people. It's a huge impact for a lot of people. It's a very complicated problem, and we're still working on it. It's pretty much unregulated, and we just have problems with a few of them, but it's enough of a deal that we need to work on it. When these people wander off and they break the law, it cost us $107 a day to put them in jail, and that's not where they should be. We don't want anybody living out on the streets. We don't want anybody living in the woods, but we also want them to be at a safe place where they get the kind of care they need. So we need to work on that. There were 65 folks arrested, and they spent at least 8.3, the average was 8.3 days in jail. And that's probably not where they need to be. The system is clearly broken, and we need to fix it. The other report we got was about our health. And sadly, we're not doing real well. We are doing better than we were. There are 100 counties in North Carolina, and Buncombe County was ranked 25 last year. We moved up to 14. Our actual population is somewhere between 8 and 9, so we're kind of close to where we should be in proportion to the other counties. But some of the reports we got on this were negative, and to be 14th in North Carolina is no great honor because the state of North Carolina is 37th out of 50 states. So we have some real problems with our health care. The local health care is doing good. We're improving on adult smoking. We are slowly getting better about teen birth rates and sexually transmitted diseases. We have one of the best mammogram screenings in the state, which is good. We're down near the bottom on air pollution, which is something we can't do a lot about. Our recreational facilities we rank poorly, but that's a little bit of misleading because the rankings do not include the Blue Ridge Parkway, greenways, parks, trails, national forest. So a lot of the things that I think a lot of us use don't get included in there. We also, when they consider the healthy foods we have, this is amazing. They don't include farmers market or small grocery stores, which is something that Buncombe County is thriving in, and we do real well on that. So we're going to keep working. We have a wonderful healthcare director, Gibby Harris. We have a wonderful social services director, Mandy Stone. And they're working hard. Every day they get up and they figure out ways that we can do better. That's primarily what we did last night. If you have any questions, let me know. I'm David Gantt, your Buncombe County Commission Chair, and thanks for listening.